Today we're talking about something incredibly common, yet surprisingly misunderstood: dandruff. Did you know that the medical name for dandruff is seborrheic dermatitis of the scalp? And that's right, it's not just about dry skin. It's actually a mild, and sometimes not so mild, inflammatory condition where the skin on your scalp flakes and sometimes itches. But here's what's fascinating. While dandruff seems like just a skin issue, there's often much more going on under the surface, and that's where functional medicine comes in. So let's break it down. What is dandruff? Why does it happen? How does conventional medicine treat it? And how does functional medicine approach it differently? Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. So what is dandruff or seborrheic dermatitis, and why does it happen? At its core, dandruff is your scalp shedding skin cells too quickly. It's often mixed with oil, creating those classic white or yellowish flakes. And one of the main culprits is a yeast called Malassezia, which lives on almost everyone's skin. In some people, though, it triggers inflammation and irritation, and that's when dandruff actually flares up. Other factors that make the scalp more vulnerable include excess oil production, sensitivity to hair products, dry or cold weather, and of course, stress. So from a conventional view, dandruff is seen as a local scalp issue, a combination of yeast overgrowth, inflammation, and skin barrier disruption. How do we approach it in conventional medicine? Well, in conventional dermatology, the goal is to reduce the yeast and calm inflammation. And that's why treatments often include medicated shampoos, which you've probably seen at the drugstore. So let's go over them. First, we have Head and Shoulders. Zinc pyrithione, the main ingredient in Head and Shoulders, works as both an antifungal and anti-inflammatory agent, and it helps control yeast and soothe scalp irritation. Then we have selenium sulfide, like in Selsun Blue, and that is also an antifungal, and plus it slows skin cell turnover, which helps reduce flaking. The next one is ketoconazole, for example, in Nizoral shampoo, an antifungal that directly reduces Malassezia yeast on the scalp. There is also prescription ketoconazole that is stronger. So if the scalp is very inflamed or scaly, I may also prescribe a mild topical steroid. And I also actually recommend alternating medicated shampoos with gentle moisturizing ones to avoid overdrying of the scalp. And because one of the most annoying problems with these shampoos is that they do have a drying effect on the scalp. So in terms of the hierarchy of shampoos, we start with recommending Head and Shoulders, and then ultimately moving up to prescribing 2% ketoconazole shampoo if there is no improvement. Overall, this approach with shampoos and topical steroids can bring quick symptom relief. Flakes lessen and itching comes down. But here's the catch. It often doesn't address the underlying why, and that's why many people find their dandruff returns as soon as they stop these treatments. So now let's move on to functional medicine perspective. In functional medicine, we ask, why is your scalp reacting this way? Why is your immune system overreacting to normal yeast? And what's happening inside the body that's making the scalp more reactive? Some of the common underlying factors we explore are gut dysbiosis, and that means imbalanced gut bacteria or yeast overgrowth, low levels of zinc, B vitamins, or essential fatty acids, which are critical for skin health, insulin resistance or high sugar diets, which increase sebum and yeast production, chronic stress, which impacts both the immune system and the skin barrier. So based on that, in functional medicine, we might recommend comprehensive gut testing, anti-inflammatory dietary changes, targeted supplements to restore nutrient balance, and stress reduction practices like mindfulness or yoga, for example. So instead of just managing symptoms on the surface, we're working to restore balance systematically. So to summarize, at the end of the day, dandruff or seborrheic dermatitis of the scalp isn't just a cosmetic nuisance. It's often a signal that something in the body or in the skin environment is out of balance. So by combining the best of conventional treatments for short-term relief and functional medicine strategies for long-term healing, you can finally break the cycle of recurring dandruff. If you found this video helpful, go ahead, please like, subscribe, and drop a comment below. And if you are interested in functional approach to your skin issues and would like to become a patient at our Mindful Medical Functional Clinic, please go to the description of the video for more information. I'm happy to see you. Thank you so much for watching. Until next time, bye-bye.